Chapter 5, Kinetoplasta, Trypanosomes and their kin, Part 11, Leishmania tropica and Leishmania major. When you look at this next set of diseases, the next set of pathogens, they're going to fall under the umbrella of cutaneous leishmaniasis. Cutaneous basically meaning it's going to stay in the skin, or that's where you're going to see most of the pathology is at the skin, not the mucous membranes. You're going to have cutaneous ulcers are going to be one of the characteristics identifying cutaneous leishmaniasis. Depending upon where you're at in the world, Leishmania tropica, Leishmania major can lead to ulcers that are called oriental sores, cutaneous leishmaniasis, Jericho boil, Aleppo boil, Delhi boil. So this should tell you the region, the area of the country, they have their own name for tropica and major infections. It's going to be sandflies are going to be our biological vector of choice here. Genus Phlebotomus, okay? Phlebotomist. That name alone tells you that they go in for blood meals. Phlebotomy, phlebotomist, okay? Life cycles. The amastogotes get taken up in the blood meal, travel to the pharynx of the sandfly. They go, and during the next blood meal, they will be injected into the next human host. Multiply in the skin, in this underlying skin tissues, and it stays pretty much a localized infection. You're not going to see this one, there's not going to be a parasitemia. It's not going to show up in the central nervous system or any place else like we saw with the trypanosomes. This is going to stay localized within a few inches, within a few centimeters of the bite. Low numbers get inoculated, get injected into the human host. So it's going to take a few days, the incubation time here, as the numbers increase through asexual reproduction. You're going to see at the bite's wound site, a red papule is going to form within the first few days. For most part, people, that's going to disappear. As the numbers decrease, the inflammatory response doesn't completely overwhelm the tissues. The immune system comes and clears it out. For some people, there's going to be an over-response of the immune system. Your immune system, instead of going in with a hammer, goes in with the sledgehammer. You're going to get an ulcer formed. Okay? Ulcers are going to be areas of active infection where the tissues, the dermal and the epidermal tissues, specifically starts at the epidermis, and then as it gets worse, it'll travel down deeper and deeper into the tissues and gets into the underlying dermal layers. The tissues become necrotic, the tissues liquefy, and you'll have a surrounding area of inflamed tissues. With cutaneous leishmaniasis, due to tropica and major, you could actually get a slight crusting over, a scabbing over, and then underneath it, a few millimeters deep ulcer. If it continues on, it may get larger and larger at time. What started off as maybe a half a centimeter, quarter of an inch in diameter, can become, for some people, an ulceration that's about the diameter of an American quarter. Here you can see here, this is a few ulcers from tropica and major, or major, that have fused into one big one. And it just will keep getting bigger and bigger. And it's not deep. It's not going to go down, past the epidermal into the fatty tissue, the adipose layer, and the underlying muscular tissues. But it will be full epidermal depth, maybe into the underlying dermal layers. The papule or the ulcer will heal, but it's going to take time. If it's just a papule, that's going to heal within a few weeks, maybe a couple of months at most. The ulcer, a few months, it's going to take quite a few months for that to completely heal over. The issue is, if it's an ulcer, that there's going to be a chance for a secondary infection. A secondary infection is an infection, be it generally it's a bacterial or a fungal infection, that under normal conditions would not have occurred, but because of a first infection, here, a parasite infection, leading to an ulcer, the ulcer gets a bacterial infection within it, which exacerbates the problem, makes the ulcer much worse. It'll become deeper, it'll spread diameter and get bigger, and you get a much greater inflammatory response. Immunologically, what we find here is that the old world infections, the ones that happen in Africa, Middle East, India, and whatnot, and blah, blah, blah. An initial infection, a small one, even one that results in an ulcer, gives lifelong immunity to any subsequent infections. Because of this, in different parts of the Middle East and in Russia, they tried to make this into a childhood vaccination. Go through and just vaccinate everybody. Ran into some problems there. Secondary infections, ulcerations, and whatnot meant that they abandoned this and haven't tried to pick it up since. Diagnosis here: scraping of the ulcer, scraping of the underlying tissues, and put it on a slide. Look for the A mastigotes. Find the A mastigotes in an ulcer that's in a localized infection. That pretty much points to tropica and major.